Aichmophobia, also known as fear of needles or needle phobia, is a common condition that affects millions of people worldwide. This fear can be so severe that it interferes with a person's ability to receive necessary medical treatment, such as vaccinations or blood tests. People with aichmophobia can experience a range of symptoms including rapid heartbeat, sweating, shaking, and even fainting when exposed to needles. The fear can be so debilitating that it prevents people from seeking medical treatment that is necessary for their health and well-being. It is important to understand the causes, symptoms, and available treatment options for aichmophobia in order to help those who are struggling with this phobia. The exact cause of aichmophobia is not known, but it is thought to be a combination of genetic, environmental, and psychological factors. Some people may have a family history of phobias, while others may have had a traumatic experience with needles in the past. Additionally, some research suggests that people with aichmophobia may have an overactive amygdala, the part of the brain responsible for the fight or flight response. Moreover, cultural and societal factors can also contribute to the fear of needles, with some people living in cultures where the fear of injections is more prevalent. It can start at a young age, and in some cases, a bad experience during childhood can lead to an irrational fear of needles in adulthood. Symptoms of aichmophobia can include rapid heartbeat, sweating, shaking, and even fainting at the sight of a needle. In some cases, people with this fear may go to great lengths to avoid needles, such as avoiding medical treatment or vaccinations. The fear can affect the daily life of a person and make them avoid activities that involve needles. This can be problematic for those who need to take regular medications or for those who need regular checkups. Treatment options for aichmophobia include therapy, such as cognitive behavioral therapy (CBT) and exposure therapy, and medication, such as antidepressants. Cognitive behavioral therapy (CBT) is a form of talk therapy that aims to change the thoughts and behaviors that contribute to the fear. This may include identifying and challenging negative thoughts, learning relaxation techniques, and gradually exposing the person to needles in a controlled setting. A therapist can help the person understand the fear and help to change the way they perceive needles. This can help to reduce the symptoms of aichmophobia. Exposure therapy is a form of CBT that involves gradually exposing the person to the feared object or situation. This may include starting with pictures or videos of needles, then moving on to practicing handling a needle, and eventually receiving medical treatment with a needle. This kind of therapy is considered one of the most effective treatment options. It helps the person to confront the fear in a controlled environment, and this can help to reduce the symptoms of aichmophobia. Medication, such as antidepressants, may also be used to treat aichmophobia. Antidepressants can help to reduce symptoms of anxiety and depression, and they may also be helpful in reducing symptoms of phobia. It can also be helpful to combine medication with therapy to achieve the best results. Conclusion: aichmophobia, or the fear of needles, is a common and debilitating condition that affects millions of people worldwide. It is characterized by intense anxiety and panic in response to the sight or thought of needles, and can prevent individuals from seeking necessary medical treatment. The exact cause of aichmophobia is not fully understood, but it is thought to be influenced by a combination of genetic, environmental, and psychological factors. Cultural and societal factors may also play a role in the development and expression of this phobia. Effective treatment options for aichmophobia include cognitive behavioral therapy, exposure therapy, and medication. These treatments are tailored to the specific needs and individual characteristics of each person and can help to reduce symptoms and improve overall quality of life. It is important for individuals with aichmophobia to seek professional help if their fear is preventing them from receiving important medical care. A mental health professional can help to create a personalized treatment plan and provide the necessary support and guidance to overcome this phobia. Additionally, family and friends can play an important role by providing emotional support and understanding during treatment. Additionally, it is important for the healthcare providers to be aware of this phobia, to provide a sensitive and patient-centered care to minimize the distress caused by needles to the patient. Moreover, advancements in technology such as the use of pain-free needles and virtual reality technology can help to reduce the distress caused by needles. Overall, aichmophobia can be a debilitating condition, but with the right support and treatment, individuals can overcome their fear and regain control of their lives. It is important to understand and recognize the signs of this phobia in order to provide the necessary support and guidance to help individuals overcome their fear of needles.